Well, hello and welcome to the Health Hub, week 2, and people said the show just wouldn't last. So Health Hub is all about latest in news, getting some good advice, and basically helping you to stay your best and stay your healthiest, because you are really the most important asset that you own, which is something we will talk about probably next week, I think. Alright, so this week, anemia. Is it a riboflavin deficiency, riboflavin, B2, or an iron deficiency, more common than you might think? Is stress shortening your lifespan? Paracetamol, yes, the most common over-the-counter pain reliever in Australia, probably the US as well. And natural stuff, is it safe or can it actually hurt you? So, keep on watching, we'll be covering some really cool stuff. Okay, so let's get started with the episode for this week. My name's Gary Borman. I'm a qualified naturopath, and I've completed extra studies in nutritional medicine and herbal medicine. I've been in clinical practice for well over a decade now, so we've seen a few things. I do need to read this little disclaimer to you. The following segment should be considered as information, education and entertainment only, not to be designed to replace professional individualised recommendations, and nor does it infer ceasing prescription medications. If the information presented here causes concerns about your current health regime, discuss your concerns with the prescribing clinician or a qualified healthcare practitioner in a proper clinical environment. That does not mean at the local health food store. That means in a clinic where you're going to have diet lifestyle taken into account. And I'll just put my teeth in, and hopefully we'll get through the rest of the show without too much more mumbling. Okay. So, anemia, very, very common thing in the Western world. Everyone just thinks straight away anemia, that's a problem with not enough iron. And yes, that can be the case. Iron deficiency is very, very common. We see it a lot in women, especially menstruating women, because of the monthly losses. However, some people don't respond to iron supplementation. And there could be a very good reason for that, and it could be as simple as vitamin B2. Now, vitamin B2, known as riboflavin, to most people, active form is known as riboflavin 5-phosphate. There's the nerd section. It's that stuff that causes you to have really fluorescent urine when you're having a multivitamin. It's the natural colour of it, and that's one of the reasons why docs go, oh yeah, multivitamins just cause colourful urine, you pee it all out. Well, we'll touch on that a little bit later. But ironically, vitamin B2 is essential to avoiding anemia. It has been shown to affect the absorption of iron, so that's why people that take iron supplements sometimes don't respond and they're still quite anemic. And it actually affects the metabolization and mobilization of iron stores, so what we call ferritin, into the circulating form of iron. So it can just stay all nice and locked up, and you just don't have access to all of that iron you've been ingesting if you're really deficient in vitamin B2. Really quite simple. We also need vitamin B2 to make red blood cells. And we've got something like 100 trillion of these things running around. Red blood cell lasts 120 days before it's replaced. So we're constantly replacing all of our red blood cells every 120 days or every 4 months. So quite important to have this process going on very efficiently. One of the chemicals we make is called erythropoietin, and that's what helps make red blood cells. And for those that are sporty minded, they might have heard of this stuff commonly called EPO. That's what a lot of these cyclists get done for blood doping, because they use extra EPO to make a lot more red blood cells. They can carry more iron, carry more oxygen, and therefore they've got more stamina. They can ride a lot harder in places like Tour de France, where there's a lot of hills and mountains going on. That doesn't mean that if you go taking a lot of vitamin B2, you're going to get done for a blood test. No, not even slightly can that happen. However, the opposite does apply. That if you're really low in vitamin B2 and you're not making enough red blood cells and that repair process isn't going on, you're not going to be able to carry around as much iron or oxygen, so you can naturally feel a lot more tired, fatigued, lightheaded when you're getting up, and just generally flat. One of the other things that we need to consider here with vitamin B2, a lot of our B groups, they like to work in synergy. So B2 and B6, they're really good friends, and B2 is essential for the conversion of B6 into its active form. And you go, yeah, so what? Picking a lot of numbers. Well, vitamin B6 is one of the things that's crucial in all aspects of the nervous system. So we talk a lot of stress, anxiety, plenty of people stressed out in the world. antidepressant use is out of control. Well, if you're low in B6, this is going to impair all of those normal processes anyway. So can it be as simple as low B2 interfering with B6, interfering with poor nerves? All of these things have to be ruled out. And I would certainly consider all of these before getting on to the antipsychotic medications. I don't think they're very good for you. Now, the RDI of vitamin B2 is only 1.5 milligrams per day. Now, the RDI, you've probably all heard of it, it's on the back of all your cornflakes packets, etc. It is known as the recommended daily intake. However, that's not where the sentence ends. It is the recommended daily intake to avoid diseases of deficiency. So it is far from optimal health, and it doesn't take into account things that you may or may not be doing and any drugs that you may be taking. And this is where the real problem comes in with a lot of people. We know that vitamin B2 is excreted by alcohol, very readily actually, the oral contraceptive pill and coffee. So the three things that are most common in your average mid-20s female who's always walking around going, oh, I'm so tired, don't know why I'm so tired, only went out Friday, Saturday night, can't cope anymore, getting old at 25. Well, that's probably one of the big reasons. They are literally depleting themselves of some of their B groups. Well, they are quite heavily, and they're just feeling the lack of energy that flows from it. Other things is most of our antibiotics as well. There are some classes of antidepressants, anti-anxieties, and even antipsychotic drugs. So it's one of those great ironies that people who need a lot more support in that area from a B6 perspective are actually taking drugs that might well be depleting them of something that could help. So, very interesting. Now, how long does this stuff stay around in the body is one of the big questions. And this is where we're talking about doctors going, oh, it's expensive urine. Well, normally, the half-life of what you ingest is only 1.1 hours. And when we talk half-lives, that is the amount of time to excrete half of what you ingested. So if you ingested 10 milligrams in 1.1 hours, boom, half that's gone, you've only got 5 milligrams left. And because it's nice and fluoro, next time you go to the toilet, you have a nice fluoro void, and the average idiot, person who doesn't understand how vitamins are metabolized, will say, oh, there you go, so you didn't do anything, you're just peeing it all out. No, it's just because you took a decent amount and normal processes said you absorbed it and you peed half of it out, and because there was lots, you've got fluorourine. So at 1.1 hours, that means this stuff doesn't last long in our body. Scientifically, they say 10 half-lives and it's all gone. So we need to be taking vitamin B2 on a very regular basis from food or a supplemental source, and nuts, avocados tend to be some of the best sources we see of our B groups. So there, in short, need it for nerves, need it for iron, need it for energy. So B2, could it be a problem? Alrighty. Secondly, stress. Oh, I didn't go through a menu properly this morning. Gee whiz, not doing well, second show in. Stress, is it shortening your lifespan? Well, there is a very strong possibility that it is. We all know that stress is at its highest now than it ever has been in all of mankind. We are under stress from things that we're adding into water, food, air, pressures of work, the general society pressures that we're under, and social media even. A lot of people are really suffering a lot because they're having self-image issues, they're getting bullied. So stress is coming from a lot of sides that didn't exist in human history. So we have Marion Chatelain and Marta Zolkin from the University of Innsbruck. They've been doing a lot of really cool research on stress and its implication on lifespan. And where they've been looking is around these things called telomeres. And again, these are things that have been mentioned in the press. Telomeres, they're like little caps that go on the end of our DNA, so just our chromosomes, sorry. So just think of the little X's. These are little caps that stop it all falling out and unraveling in very simple terms. Now, every time a cell divides, these little caps get shorter and shorter and shorter, and they're using that as one of the measurements of aging. So when you run out, well, basically that's it. Your time is up, and see you later. Well, what these people are focusing on is finding out, are there things that accelerate the rate of telomere shortening, and are there things that can slow the rate of telomere shortening without having detrimental effects on normal cellular repair. And very, very cool, they are finding, yes, you bet. By far, the biggest thing they found was stress and the negative impact that it caused. Also finding stuff like poor diet, urban living, they did hasten aging, but to a lesser content, and pathogens and infections. And this is where it gets very interesting. Look, we're looking down the track. Last week we talked about how antibiotic resistance is coming through so fast. Scary stuff. And every year we're seeing viruses. The flu virus seems to be more potent and angrier than it was previously, and the worst flu season on record. Starting to hear that pretty well every year. It's getting a bit of a tired message. Things are changing, and they're changing way quicker than us humans are. So that's another thing that's putting a lot of stress on us. And could we well see that now we've got average lifespans up into the 80s, but over the last couple of years they're actually saying these average lifespans are starting to shorten down for the first time in recorded human history. Something to think about. So what these researchers also talked about is the oxidative stress that is caused by stress. Well, need another term in there. So antioxidants certainly can play a big role in this. That doesn't mean go berserk with them. You can actually have too much in the way of antioxidants, but we probably need to increase what we are taking from an antioxidant perspective, and some of the best sources is fresh fruit and vegetables. How about that? Who would have thought it? Vitamin C in particular is a very naturally occurring one, and we have a fantastic one called glutathione. It's produced in the liver by ourselves, and we need some amino acids to do that, and that's where vegans can start having a few problems. So, very interesting. If you want to live a lot longer, watch your stress levels and stay healthy. Pretty simple recipe. Alrighty, well, this week the segment is brought to you by MyActiv. Now, MyActiv, which is spelled M-I-A-C-T-I-V, is one of the latest and greatest products that I've ever come across as far as joint health goes. We've seen a lot of people get great benefits in my clinic from a rheumatoid arthritis and osteoarthritis perspective, and really having great results with reducing their joint pains. Many people have been able to totally come off their pain-killing medications. And these pain-killing meds, as you might recall, we talked about one last week, we're going to talk about one next as well. These things aren't real good for you. They can be very beneficial in easing up pain at the time, but they wear off in a few hours and you've got to take more. And they do have a fair price that they do carry as far as liver, kidneys and other parts of the body. So MyActiv, go to that site, myactiv.com.au, and really you can't go wrong with taking it. There is the product, there's the brochure. Thank you MyActiv for sponsoring this segment. You'll probably get an email about that, should have mentioned it at the start. Okay, so moving on to the next topic. Now, paracetamol. Commonly called a drug that I can't mention in Australia, so it's also known as Tylenol in the US, very common drug there. They call it acetaminophen, I don't know why, same chemical, different name. Very, very, very common. Often marketed as the pain relief product that's gentle on the stomach. Very widely used. You can get kids doses like from 1 year old or even younger upwards. Does that mean it's safe? Well, unfortunately, no, it doesn't. And here is some really interesting stuff that's come out on it. It was only released back in 2019, so way last year. But in 1 year, there were 18,000 hospitalisations for paracetamol overdose in Australia alone. That's just in Australia, of our 25 million people. That resulted in about 20 deaths and many more permanently damaged livers. Now, I really don't see that as a super safe pain relieving product. We know that you have to reapply your dose in about 2 to 4 hours because it wears off quite quickly. There are limits on paracetamol with recommendations on how much you should take. No more than 8 in a day is the recommendation. And it's actually been known as being such a bad product. A few years ago, the government went about changing the maximum sizes of packaging you can buy over the counter. Previously, you could go and buy a packet of 24 and no questions asked, when you're doing your grocery shopping. They found that a lot of people were actually getting admitted to hospital for overdose, part of that 18,000 people. So they said, well, if we only do 20 in a packet, that's going to stop people hurting themselves. Well, I don't see how that's going to make too much of a difference. We know that if you take 24 to 30, it is probably going to kill you in about 3 days with liver failure and quite an unpleasant death. And there are well-known cases that people have actually committed suicide by paracetamol overdose. Why you can just buy this thing freely over the counter is beyond me. Why it is so absolutely cheap and always on sale in those junky sort of, let's call them Bunnings-esque chemist type places. Again, that is nuts in my mind. And when we start talking how you can hurt yourself, this is where these junky warehouse places really are doing a disservice to people. One of the local things you get stuffed in your letterbox every week, you know, junk ale, they're advertising a pack of 96 for something like $6. Yeah, well, you might have to get a pharmacist to put a sticker on that. Yeah, mate, I hurt. Yeah, taken it before. Yeah, no problems. Okay, off you go. So there you go. Go and get yourself 96. If you wanted to end it all, you can do that 2 or 3 times over in one go. And the other insane part with these is those dosages we talked about that were shrinking down from 24 in a packet to only 20, they were 500 milligrams. So do the maths, I can't, something like 10,000 milligrams in total in the box. Or you can buy them known as Osteo, and they're 600 milligrams per tablet. Does not make them any cleverer, anything at all, just a bigger dose per pill, so when you pop 2 of those, off you go. Bigger dose, and therefore it's supposed to help more with your pain from osteoarthritis. There's also another one out there that's 665 milligrams per tablet, so pop 2 of those again, because one won't do anything, and you can hurt yourself that much faster. And why I say that, I'm going to take this directly from one of my pharmacology books by Professor Bernard Katzung. Here is, the book is called Clinical Pharmacology. He is a professor at, so I didn't write down where, I think it's MIT, it's one of the universities in the US. He has said, even one paracetamol is toxic to the liver. And unfortunately, once you start to notice the symptoms of overdose, liver damage has already occurred. That's from 500 milligram. So when you go taking 2 665s, well, you might have to take 4 of those a day so that you can help go surfing and give yourself all that freedom again. You really are on a road to nowhere that's any good for you. So if you've got joint pain, paracetamol probably isn't the answer for you. My Active can't hurt you. There you go, paracetamol. They're not so good pain reliever. All right, and winding up our last segment for the day, or our last topic, natural stuff. Can it hurt you? Well, yes it can. There was actually an interesting quote from a guy, Dr. Ross Walker, a cardiologist. He's been around for a long time. And I once heard him make a quote that, you know, modern medicine is like a Formula One car. Yes, it will get you there very quickly, but gee whiz, the crashes are spectacular. And yeah, you know, if you want to call death spectacular, there are a lot of side effects and come on quite quickly with modern drugs. And yes, they are very effective when used correctly and people respond appropriately to them. He then went on to say that natural medicine is like riding a bicycle. He said, yes, it'll get you there, but if you fall off, the injuries are nowhere near as bad. And that's probably one of the greatest quotes that I've heard for a long, long time. Yes, we do take a lot longer, but we do tend to have very few things go wrong when applied properly. Now, where things can go wrong is there is this crazy thing of essential oils at the moment. Everyone seems to think that essential oils are the latest and greatest things to cure all sorts of conditions, and they are marketed with a lot of fervour by a lot of people in multi-level marketing organisations. And this is where the problem is starting to come in. This study, it was commissioned in Australia and published in the Medical Journal of Australia, said that there is a steady amount of adverse reactions, so people ringing up drug lines or going into emergency rooms, with an average of 1 person a week needing assistance because of taking essential oils in a self-prescribed manner. So these highly concentrated oils have been known to cause drowsiness, choking, nausea and seizures. That's not so good. In some people they can cause rashes, burns when applied topically, which means on your skin, so on the surface, even when diluted. Some of the figures they came up with said 43% of people who use the oils did so without consulting a GP, well they wouldn't know much anyway, pharmacist or an alternative medicine practitioner. And people like me, yes, I was trained a little bit on essential oils, but certainly not in depth. So my recommendation is you don't ingest these things at all. However, one of the people who is an aromatherapist and Vice President of the Australian Natural Therapists Association, which is the association I've been in now for 14 years, they said they are never to be prescribed mixed with water on a daily basis, and said they should only be for short-term use for specific conditions and recommended by a health professional. And another site was also talking about this, and they put this into perspective with just how much you actually get when you are taking a couple of drops of essential oil. They said that it can be the equivalent of 10 to 50 cups of herbal tea, depending on the herb and the extract. Now, that's an amount you just could not ingest, or 20 times the recommended dose of a herbal tincture. So that's the herbal extracts that I use when I mix up formulas, and some people watching might have tried them and said, oh yes, those disgusting tasting things. Yeah, so think of that, 20 times more potent is what you're putting in. Now, they can hurt you, and they can hurt you pretty fast by doing that. The real kicker here is, it's quite interesting. They said they should only be taken internally where they are absolutely needed and with extreme care, and, in big letters, under the guidance of a trained professional. So someone who's in that latest MLM saying, hey, these oils are fantastic, you should take this. Oh yeah, you can take them internally to get rid of your IBS, it'll help with this, you know, make your hemorrhoids go away. Yeah, possibly not, but it could really hurt you. So you have to be really, really careful with these things. And we are talking essential oils in this case. We can talk about herbs and other vitamins, mineral supplements at other stages, you know, other episodes of the podcast here. Now, what some people don't recommend, aren't aware of, is a lot of essential oils aren't recommended during pregnancy, and that's burning them. So if you put it in your vaporizer, or you've got it in your oil burner, in the first trimester of pregnancy, they pretty well said don't do any. And there are some specific essential oils, and you have to go and look that one up yourself, but juniper is one of them, and there are others, I believe marjoram, cinnamon, and a couple more that go in there. They said even in your second and third trimesters, even the aroma of these oils can cause contractions of the uterus, so it starts to contract down, and that can actually bring on miscarriage. And that really is the last thing you want when you've gone through the process of making a baby and you're looking forward to that day, and just because you want your house to smell a little bit prettier because someone's coming over, burning your essential oils and having a really bad result purely because no one told you, because your MLM friend said, oh yeah, they're okay, they're really safe, they're really a high quality product. Yeah, high quality can actually mean it's more dangerous. So, summing up, do not ingest them. That's what I was taught when I went through college. Essential oils, do not ingest any, not just some, but any. And the only ones I ever said to put on your skin was lavender and peppermint. Now, I know there's lots of other blends around that people do rub on and don't have issues with, but just take it away. Be really, really cautious when you are using these products, because, yep, they can hurt you. Well, there we go. That's another week down of the Health Hub. I hope you found this informative. Hope you might even be able to pass this on to a few friends and say, hey, this is some really good advice. Take this on board, because the last thing you want to do is hurt yourself when you really are just trying to help yourself. So until next week, be kind to a stranger, because you never can tell. One day that stranger just might be you. Until next week, take care.